Hello everyone, my name is Dr. Yesudian, a consultant dermatologist based in the UK. Today we will look at a common request from most patients. How can I look younger? We all want to have a youthful appearance, so how can we achieve it? We first need to understand the concept of healthy aging. Remember that ultimately we will all age and it is not optional. So let's look at a few general principles first and then go on to more specific measures for the skin. Geriatricians are the experts in medicine of aging, and they can teach us a lot on how we can age in a healthy fashion. The noteworthy point is that rather than focusing about living longer or looking younger, healthy aging is about experiencing a healthy lifespan. That is, living a good quality of life with reduced disease, whether it's skin or otherwise. Research from all over the world suggests that the same underlying principles are for healthy living. These include moderate to regular physical exercises, having a sense of purpose in our life, reducing stress, consuming a plant-based diet with limited meat intake, putting our family first, and most importantly, engaging in spirituality or religion. This is the same for skin aging as well. If we are able to achieve all these goals, it reduces the aging process of the skin. What are the other factors more specific for the skin? First is smoking. Smoking is a well-known independent factor for premature aging. When we smoke, we develop prominent wrinkles, skin thinning, and an abnormal skin barrier with delay in wound healing. Research suggests that if we are able to quit smoking before the age of 40 or 50, most of the detrimental effects of the body can be reversed. Next is sun exposure. This is another important factor in skin aging. We all need the sun for a healthy lifestyle, but my recommendation is to get sun exposure on our limbs and avoid sun damage on the face. The facial skin is sensitive and thin and also tends to get maximum sun exposure in our day-to-day life, as it is the most exposed part of our body. So using physical modalities like a cap or a hat when we're out in the sunny weather and using tinted sunscreens will be helpful in preventing blemishes and aging of our facial skin. I've already done a video on the importance of tinted sunscreen that may have some useful information. Next is a balanced nutrition. Not only is a healthy diet integral to prevent chronic diseases, but improvements in diet have also shown to reduce cutaneous signs of aging. One of the most important supplements is vitamin C, which is critical for collagen synthesis. Data from many studies have shown that a higher vitamin C intake was associated with lower risk of wrinkles and reduced photoaging. Having supplemental vitamin C is also very beneficial, particularly if you have thin skin. This is another topic that I've covered earlier. Having a Mediterranean type of diet with more plant-based food and reduction of red meat is also very beneficial. Try stopping to eat when you're about 80% full, and this has immense health benefits, not only for our skin but also for our general health. Exercise also benefits skin health by increasing blood flow, which is critical for the delivery of oxygen and nutrients to the skin. This in turn promotes collagen production and is also essential for the formation of new skin cells. Research has shown that men and women above the age of 40 years who participated in more than 4 hours a week of aerobic exercise had thicker dermis than individuals who participated in less than 1 hour of exercise per week. In one study, when sedentary older adults were enrolled in a 3-month cycling program, the researchers found that significant increase in collagen content of the skin. So it is never too late to start exercising to the level that you feel comfortable with. Stress is also a very important factor. Repeated and prolonged stress can lead to reduced immune function, impaired wound healing, and increased inflammation, which can aggravate certain inflammatory dermatological conditions. Signs of chronic stress often manifest as increased wrinkles and stress lines. Stress reduction could therefore potentially play a role in decreasing signs of cutaneous aging. There are various ways by which we can address stress in our lives, and this information is available in another video which I've done earlier. Finally, moisturizing our skin. Our skin is exposed to the elements every day and tends to dry out on a regular basis. So, applying moisturizers to hydrate the skin and preventing environmental toxins from hurting our skin is very important. The moisturizers we apply on the facial skin is slightly different from that we use for the rest of the body. The principles on which moisturizers to apply for the sensitive facial skin and the way we apply the moisturizers on the limbs is covered in other videos in the channel. In conclusion, to have youthful looking skin with less blemishes and wrinkles, we need to address the fundamental factors that affect the complex process of aging. Lifestyle changes are the most important way of having healthy young skin, rather than expensive creams and interventional medical procedures. I hope you found this information helpful. Thank you for listening, and bye.